address the perfect cervical curve. As you can see, we're looking at the cervical spine, the neck, as viewed from the side, what we call the lateral view. And the black curve line represents what the normal curve is and to be expected. And the curve is a 43-degree curve with a 31-degree atlas plane line angle. The plane line angle is talking about the top cervical neck bone segment, where it's got a black line that's perpendicular to the curve line. And like a banana, it's soft in the inside and protected on the outside. That's the purpose of the spine, for protection and to house the central nervous system. Now that we have a normal in mind, we can start looking at the 4 phases of decay. Here we have an example of David, a 21-year-old, a snowboarder with many head and neck injuries. He has constant headaches and neck pain. He's taken painkillers, anti-inflammatories, and muscle relaxants for years. Clearly, you can see that his neck does not match the black curve line. He has a reverse cervical curve that's reversed and opposite of what the expected normal is. This causes a stretching of the spinal cord and compression of the brainstem. And the discs are already degenerating, as noted by the arrow. Here we have phase 2 of decay. We have a 45-year-old with an S-shaped cervical curve. Not only is it opposite curve, you can see by the red line it actually has more of an S-shaped presentation. And this is accompanied by headaches, neck pain, numbness, tingling, and weakness in the arms and the hands. There's a 1 to 2 millimeter of disc space remaining. The different vertebrae in several segments are coming closer and closer as the disc degenerates. You can see huge bone spurs at the front of the C4 and 7, as indicated by the arrows. And we call this as a result of Wolff's Law, which basically says bone will model and remodel based upon the stresses and demands put on it. So since there's a reversal in the curve, there's an abnormal weight bearing from the head and gravity that's been occurring over the years, and the body will basically perceive that it needs more strength and start adding bone to these areas. And this person is taking even more drugs and degenerating 10 times faster than a healthy cervical curve. Next, we'll look at phase 3 of decay, and this is a 53-year-old. Degenerative fusion, disc loss, and bone spurring is indicated by the arrows. Clearly you can see the normal black curve, and the actual shape of the neck is represented again by the red line. This person is becoming a surgical candidate. There's minimal nerve flow, and there's permanent loss of motion and permanent nerve damage. Here are the phases of decay side by side. With on the far left being normal, you can see that the shape of the neck pretty much coincides with the black curve line from the lateral view. Phase 1, you've got a loss of the curve, an anterior carriage of the head, and you're starting to see some disc space reduction between the 6th and 7th vertebrae. Phase 2, not only is it reversed, but we're actually seeing more areas of disc degeneration and bone spurring. And in this particular case of phase 2, the person actually has a double curve in their neck, which is really not healthy. And in phase 3, we're seeing multiple signs of fusion, bone spurring, where the bones actually start growing together. There's almost complete obliteration of the disc spaces, and the neck, you can see, is far from the normal black line. And the spine is made to last about 80 to 120 years if it's maintained properly. Here we have a normal lumbar spine as viewed from front to back. You can see that the spine is straight up and down. This is a 53-year-old female, and the spine is in the midline. The hips are even and parallel to the floor. You can see, if you look at the hips, there's a little black line on the top of each pelvis, or each hip bone. And the nerves in this area control the bladder, bowels, and tell our legs how to move and perceive, the tingling, numbness, hot, cold, things of this nature. Here we have a subluxated lumbar spine. Again, it's supposed to be straight up and down the midline. This spine clearly is not. This is a 78-year-old female. This did not happen overnight. And she's approaching the age of the average life expectancy. You can see the S-shaped curve, or scoliosis, fusion of L4, L5, which is the 4th and 5th bones of the low back out of 5. And there's zero disc space at the L4, L5 level. This particular patient presented with loss of bladder control, paralysis of a right leg, and clearly is a candidate for spinal fusion surgery, which carries a 50% failure rate. Definitely a quality of life issue. So which one do you want? The normal one on the left, where the spine is straight up and down in the midline and aging gracefully, or the phase 3 degeneration of the 78-year-old? Let's look at a few cases. Case 1, we have Larry, a 58-year-old. He fell sideways while lifting a heavy box over his head 20 years earlier. Low back and leg pain for 20 years. Pain and numbness has been getting more severe, more frequent, and staying longer and longer each time. This is a big warning sign, by the way, is when you're looking at your frequency, intensity, and duration of your pains or symptoms. This patient has been prescribed many different medications and bed rest by various MDs, and has clearly degenerative bone and disc disease. This is Larry 12 months later after being adjusted 3 times per week for 90 days. Then care was tapered over the next 9 months. You can see that there's increased disc spaces by the red arrow, and accompanied with the adjustments, he was given strengthening exercises for his spinal muscles. We'll flip back and forth between the two. You can see the black line represents the midline, and you can see the black line represents the ideal midline, and you can see where Larry presented when he presented on day 1. Definite difference 12 months later, and with a high frequency of care in the initial 90 days or 3 months. So again, day 1, 12 months later. Case 2, we have Linda, who's 49 years old. She works in a hospital, presented with headaches, neck pain, and numbness and tingling in her hands that she thought was normal. Prescribed painkillers and Neurontin for the numbness. Never had an x-ray, despite her symptoms. Her cervical curve is reversed, as you can see, by the black line indicating normal and the way the red line is actually tracing her actual spine. She has degenerative bone and disc disease, and 2 to 3 millimeters of disc left at the C5, C6 level. This is Linda at day 90. She was adjusted 3 times per week for 90 days with cervical extension traction. This is actually putting her neck back in extension, looking backwards with a stressor on it to stress her and maintain this position. You can see that the disc space is increasing, and the cervical curvature has improved, and symptoms are 100% gone. But is she healthy? Is her care really finished? If you look at the black line representing normal and you look at the red line representing abnormal, you can see that she clearly is not. Again, look at the distance between the midline of the red line and the black curve, which represents normal, and you can look 90 days later, they're getting closer approximated, but she still is not finished. This is Linda at 15 months. Care was tapered in frequency as she progressed. She transitioned to home traction and spinal exercises. She now, at this point, has almost a perfect C-shaped curve, and she continued to be adjusted once per week for maintenance care. Now, the maintenance care is really critical and crucial, because we continue to have activities of daily living that promote this reversal. It doesn't happen overnight, and it's our day-to-day activities, traumas, these different issues that are left unaddressed that basically get us to this curve reversal in the first place. So just like a child who wears braces and then has the braces removed, they don't just go on with life. They have to wear a retainer for a certain period of time to maintain and let the soft tissues and the ligaments and everything basically shorten and contract to maintain that position of the teeth for the future. So here we're looking at all of Linda's care from day 1 to 15 months side by side. Again, you can see the reversal curve at day 1, the progression by day 90 with the symptoms abated or relieved, and then the near perfect curve at 15 months. Big difference. Here we have case 3. Now Lindsay is 10 years old. 10 years old. Now take a notice, because it's glaringly obvious, of course, of where the black line normal is. Not only does she have a loss of curvature in the lower segment of her C-spine, of her cervical spine, she also has a severe head-forward carriage. Now Lindsay was in a 10-mile-per-hour rear-ended car accident when she was 5 years old. She has had constant headaches for 5 years. The doctors at the hospital where her mom worked told her to take Tylenol every day and she would eventually grow out of them. Her mom was worried about liver and kidney damage from the medication, of course. Now this is Lindsay at day 90. She was adjusted 3 times per week with cervical extension traction. Again, this is a protocol with the neck put back in an extended position with tension or a load applied to really stress this position. Her headaches were completely gone, and she was no longer taking Tylenol at this point. Her cervical curvature is about 50% better, but is she healthy? Is her care completed? Take a look at the black line representing normal and the red line representing abnormal. This is Lindsay at 12 months. 95% improved. Her care frequency was tapered, and she was graduated to home cervical traction and exercises. She has no headaches or Tylenol for over 9 months. Look at the black line representing normal and the red line representing her current curvature at the time that this x-ray was taken. Again, the 3 different periods represented here from left to right: day 1, day 90, and 12 months. This was not corrected overnight. Her symptoms abated by day 90. However, she wasn't finished with her care. The fact that the symptoms are removed does not mean that the condition and the adverse effect of the condition is still not crucial to address. And you have 12 months, and again, she wasn't just released from care. She was prescribed a continuation of the traction and home exercises in order to continue to remodel that neck to perfect. Now take a look at this normal spine here. Clearly you can see what the black line representing normal and the red line representing the current position of the spine is very close approximated to normal. This is not a corrected curve. That means this person just presented naturally this way. It's almost a perfect cervical curve, almost zero degeneration, almost perfect disc spaces. He is 68 years old. This is a 68-year-old spine. So you can see that age has nothing to do with it in a direct causation of spinal degeneration. How about this spine? This patient, Diane, was 59 and had a reverse cervical curve. She presented with headaches, blurred vision, neck pain, numbness, tingling, digestion problems, breathing difficulties, heart palpitations. She couldn't lift her arms over her head anymore. She has a complete fusion of C4 through 7, and C4 is on the way to getting this way as well, and she has almost zero disc spaces between C3 and C7. Almost every cervical disc space has been obliterated. She has severe stretching of her spinal cord, as you can tell from the reverse cervical curve. This is going to produce massive compression of her brainstem. She was taking 10 different medications. Now, she actually had her liver enzymes checked every 6 months to make sure that the drug she was taking was not killing her faster than what they were giving her the drug for. The worst part is that she had seen 3 different chiropractors over the last 10 years and was looking for a new chiropractor to continue with her, quote, maintenance care. All of her symptoms are signs that her organ systems are failing. She is slowly dying. Her HMO allowed 12 chiropractic visits per year. Now, based upon the x-rays and the previous slides that we went through, from the various ages from 10 years old up through 58. Do you think that Diane's spine could have been corrected if she was adjusted just once a month, based upon what the HMO allowed chiropractic visits per year were? Of course not.